Well, good afternoon, everyone, and welcome to this webinar. My name is Jennifer Whitener, and I am the Benefits Manager with Larimer County. Today's webinar is going to focus on a subject near and dear to my heart, which is healthcare in Northern Colorado. We're going to focus on a few different areas today. Because we're going to be covering several topics in a short amount of time, I do ask that you provide your questions in the chat. And then at the end of the presentation, we can go through those questions and answers together. So with that, we'll go ahead and dive into the agenda for today. So the first thing we're going to talk about in a little bit more detail is the self-funded health plan and how it works. We'll talk about transparency in healthcare cost and why that's important. We're going to talk about reasonable cost and what does that mean when we're thinking about our medical costs. What do we consider reasonable? How do we measure that? And then we'll focus on employer and employee actions. As an employer, what is Larimer County doing to help manage our health plan? And as an employee, what resources are available to you and why does that matter? So with that, we'll go ahead and just get into the background of why we have a self-funded health plan. So just what is a self-funded health plan? You might have also heard of this referred to as a self-insured health plan. Well, in this instance, the employer, so in this case, Larimer County, assumes the financial risk for providing healthcare benefits to employees. That's different from a fully insured plan, in which the insurance company assumes the risk and the employer pays a fixed premium per employee per month. And so Larimer County is a self-funded employer, which means the money we collect from the departments and from our paychecks for the medical plan expenses all goes into a separate fund, which is called Fund 645. And then we use those funds to pay for our medical plan claims. And the reason why we are a self-funded health plan and why most large employers are self-funded is because it is more financially advantageous for us to fund our own claims and take on that financial risk over the long run compared to a fully insured plan. Typically, we'll see when you do a fully insured plan, the rates that the insurance company sets themselves are going to be significantly higher than the rates that we, Larimer County, set ourselves. And usually that margin can be very significant, anywhere up to 30%. So that is why we as a large employer have made that choice to be self-funded. But there's great responsibility that comes with that. And so first and foremost is understanding our role as a fiduciary. So in this role, the DOL has actually provided specific guidance in terms of how we should be running and managing our plan if we're going to be self-funded. First and foremost, the instructions are to run the plan solely in the interest of participants and beneficiaries and for the exclusive purpose of providing benefits and paying plan expenses. They want to ensure that we're carrying out our duties prudently, that we're following plan documents, holding plan assets in trust, and paying only reasonable plan expenses. And I wanted to highlight that last point in terms of paying only reasonable plan expenses, because recently we have actually seen lawsuits come about on the private sector side and some very large organizations, probably the most prominent being a lawsuit that's pending with Johnson & Johnson, where their plan participants have challenged for their prescription drug plan whether or not the expenses that they are having to pay are in fact reasonable. And as the employer's role as a fiduciary, have they done their due diligence to ensure that what they are paying under the prescription drug plan is in fact reasonable? So it's something that is taken very seriously, and why we want to be very transparent in terms of costs, in terms of how we manage our plan, and ultimately, empower our employees to feel like they do have the ability to dive into this information further. Now, in terms of the self-funded health plan and how it works, I like this visual because it kind of breaks it down in a nice, easy, flowing way to help you better understand the process. So, what happens is you go to the doctor, so you have a service done, you have a surgery, for example. Well, they then submit that bill to our third party administrator. So, our third party administrator, or TPA, as what it's called, is Meritain in this instance. And Meritain uses the Aetna network. And so the Aetna network is who has a contract with the doctor to say, we agree to pay you, X amount for this surgery. And they do that for every service line that a provider can offer. So the claim comes in, the TPA will pay the claim based upon those contractual terms and where a member is at with their out-of-pocket expense for the year. And then they will process that claim, send payment to the provider, and they will ask the employer, so they will send a fund request to Larimer County weekly to say, hey, we paid $300,000 out of the account this week that we need funded for your medical claims. And so this is the process that's happening every day. It's over 30,000 transactions or claims that are getting processed over the course of the year for our plan. It is the way that a self-funded health plan works. So gives you a nice visual on how that is put together. So something that we talk about a lot in human resources and in the benefit space is the importance of transparency and cost. Something that legislation, fortunately, has been in our favor over the past several years, where we're trying to lift that veil and we're really trying to be able to provide solid information to patients and members to say, you can find out what the cost is going to be for a procedure you're going to have. And not only that, but we like to provide transparency in terms of our costs. So you can see how that compares across the nation and across the state. So when we looked at our Larimer County medical plan costs for 2023, the average medical plan cost per employee per month calculated at about $1,368. Whereas nationally, that average is slightly lower at $1,081. So we recognize that our costs are slightly higher than the national average here. And when you look at just our total dollar medical plan spend for Larimer County, our health plan spend was $30.7 million for the medical plan last year. So this is a very big expense. And because it's such a big expense, again, going back to our previous slide, we want to be very prudent and be as educated in terms of why we are paying what we're paying as we can. Now, where we are in Northern Colorado, we have a very highly concentrated market where the University of Colorado Health System, or UC Health as most people know it, is the dominant provider of healthcare up here. When we looked at our Larimer County calendar year claims for last year, UC Health represented 46.4% of all paid claims for last year. So of that $30.7 million bucket, 46.4% of those dollars went to UC Health. And that's looking at both hospital and professional services that would be provided in a doctor's office. The next highest utilized provider was HCA Health One at 7.6%. So there is a significant delta in terms of where our health plan members are receiving their care. And that matters in terms of ultimately what we end up paying over the course of the plan year. So is what we're paying reasonable? Is $30.7 million what we should be paying? How do we even go about that? Well, there are several benchmarking surveys and reports that we have access to at our fingertips. But there is one that we consistently have referred back to called the Rand Corporation study. And it's a national study that the state of Colorado does participate in, where we will compare this data from 2018 and then look at the most recent survey results that were for calendar year 2022, so you can see that difference. The basis of this study is to say, what is the rate that Medicare has negotiated with hospitals for the services they provide? And how does everyone else who's not Medicare, such as employer health plans and fully insured health plans, how does that compare to Medicare reimbursement rates? Are we right in line with that, or are we higher than that? And so if I start at the left side of this chart, we had a ranking. In 2018, 87 Colorado hospitals had participated in this study. And so we have our ranking here, followed by the hospital name, the city and state where they're located, the hospital system that they are in, or indication if they're an independent facility. And then our figures on the right is our relative price for outpatient services, for inpatient services, and then combined inpatient and outpatient services. And so we'll just start with that first row on the top so we can kind of talk through what that means. So in 2018, Colorado Plains Medical Center was noted as the highest cost facility when we looked at prices relative to Medicare reimbursement rates. So for every dollar that Medicare spends, the relative price charged to non-Medicare plans, such as employer health plans, was 692% greater than that. And for inpatient services, 319% higher. And then the equivalent on a combined basis. More services now are performed on an outpatient basis than an inpatient basis at hospitals, which is why you tend to see the combined amount slightly higher, since outpatient services relative to Medicare reimbursement rates tend to be higher. So what was intriguing when we saw this data in 2018, though, was that our two most utilized hospitals on our health plan were number 7 and 8 compared to all other 87 hospitals in the state, meaning that what they are charging compared to all the other hospitals in the state, they were the 7th and 8th most expensive. And so you can see here for Medical Center of the Rockies, that combined relative price was 373% higher on average than Medicare reimbursement rates. And Poudre Valley Hospital right below that at 370%. Now, What's great about this survey is that it is free and accessible to the public. And so I have the path for that survey here. I highly encourage everyone to go out and look and play with that tool because this is just a snapshot of several other data points that we're able to view and see. In this initial 2018 survey, they did not have quality rankings in there. They have added that now in 2022. So it's a great resource that we can go back to when we want to look into, well, how do we compare to the rest of the state? And you'll also see that we did take a look at Banner Fort Collins Medical Center and McKee Medical Center, since those are two other large hospitals out here. And Banner Fort Collins was ranked number 46 overall in terms of cost relative to Medicare. And McKee Medical Center was ranked number 20 overall. So as I mentioned, we look at this every year, and the most recent report was for calendar year 2022 data. So again, we have our top 8 Colorado hospitals here. There were only 79 in the study this year. But you will see that when we're looking at the same top 8 compared to 2018, Medical Center of the Rockies and Poudre Valley Hospital are now the 5th and 6th highest cost facilities in the state when we compare prices relative to Medicare. I also noted Swedish Medical Center was number 7 because it is an HCA healthcare facility, and HCA healthcare was our next highest utilized provider that we work with up here. Now, the positive I have for this is that when we looked at the relative price for inpatient and outpatient services compared to the 2018 slide, these are lower. They are coming down. And, that is the work of members of the community. I think it is acknowledgement from UC Health leadership that they were very much aware of where they stood in terms of pricing within the state of Colorado. So it's not to say that they don't know or that they don't care, but the data speaks for itself. And so it's something that we have to keep in mind when we're thinking about our health plan, because the hospitals that we're going to pretty much for everything are the most expensive in the state. And there's other ways that we can compare costs. One tool that we have at our fingertips is Healthcare Blue Book. And Healthcare Blue Book uses data feeds that they receive from all of the major insurance companies. So from Blue Cross, United, Cigna, Aetna, Kaiser, and they're able to aggregate that information. And on a per procedure level, and even looking at a provider level, provide us details in terms of average cost and quality for specific procedures. And so what I always like to tell folks is that one facility might charge a very reasonable price for one procedure and a not so reasonable price for a different procedure. It really does vary across the board. And so that's why we like to share this tool with our employees. They have an app, they have a website you can use, because it puts the power in your hands to be able to compare and look at that difference over time. And it also will give you quality information so you can see who has the best reported outcomes in terms of having a particular procedure done and who maybe doesn't have the best outcomes, because one hospital is not the best at everything. And that's what I like to stress to people is you really should do the research and find out who does your procedure that you need the best. because it does vary from provider to provider. So with this example here, I just did a quick search and said, okay, what if I need to get a total knee replacement? And I wanted to have this done in Denver. So I just used up here the 80205 zip code. And it will show you a list of results of providers in that zip code and start to break down the cost. And so it gives you a range because, again, the cost varies very widely depending on where you go. And so on the lowest end, the total cost for that procedure in Denver was just over $19,000. And the high end cost for that procedure was $61,000, with the average fair price being about $37,000. And you'll know, and what's nice is that it does show that represents not only the facility cost, but what other physician charges would be included with that procedure, as well as anesthesia. So then I did that same search, but using our 80521 Fort Collins zip code. And the result for that was significantly different, as you can see here. So if we look at even just the lowest cost facility in our area, it was at $36,000. So comparing that to Denver, nearly double the cost just from the starting point. And on the high end, the highest cost facility in our area to have that procedure was $113,000. So again, nearly double what we would see in the Denver market. And so the quoted fair price for our area is $45,000. But it helps put into perspective how much of a difference there can be in terms of where you're having that procedure done, even if just going an hour south to Denver, and how much of a significant impact that can have on our self-funded health plan. Another resource that we like to use on a regular basis and refer back to is the transparency cost tool offered through Civic. So that is another great free for the public to use website that can give you the ability to also drill down into specific procedures by specific facilities to evaluate cost. And then there are other TPA resources available to you as well. We always recommend when looking for a provider or a particular procedure to always check the Meritain website, make sure they're in network and participating so that you are at least assured the network contracted rate for that service. So with all this information, what do we do with it? Where do we go? It feels, it can feel overwhelming at times because there's so much to evaluate and dig through there. And ultimately, we're trying to manage the cost of our health plan and not see those costs rise over time. So our first and foremost approach that we have always taken is to offer benefit programs and resources that encourage our health plan members to use high quality, lower cost providers for care. And that potentially means looking at getting care outside of Northern Colorado, outside of the UC health system. We have multiple rewards that are available through using that Healthcare Blue Book tool, such as our $0 MSK program. So we've identified a list of musculoskeletal procedures, such as a knee replacement surgery or arthroscopies, where if you research that on the Healthcare Blue Book tool and you use one of those green providers who's identified as low cost, high quality, that particular procedure, the cost share is waived. So you would have that procedure done at no cost to you. That is reserved for just those on the choice and standard plans. But if you are on the high deductible plan, you can still qualify for a reward where you're able to have Healthcare Blue Book provide you a reward after the procedure for accessing that high quality, low cost provider. The next item is direct contracting. And this is something that I think a lot of folks may not realize that we're constantly looking at and evaluating. Probably our biggest direct contract that we have is our contract with Marathon Health. And Marathon Health is who operates our wellness clinic. And that contract has been in place for many years now. But the strategy with doing that direct contract is that in working with Marathon Health, the cost that we pay for their services is actually less than what we would pay if individuals were seeking care with providers that were parts of other healthcare systems here in Northern Colorado. So we have a claim savings in terms of what we're paying for that care. And what is also beneficial from that agreement is that they are independent of any health system. So when they need to refer care out, they are working as an advocate for you, knowing what tools and resources we have available with our health plans and how our Larimer County health plans work to refer you to the best outside provider that they can. Another example of a direct contract is the agreement we have in place with Family Care Center. So they are a mental health provider here in Northern Colorado, and they have locations in Southern Colorado as well. But we put an agreement in place with them that gave us priority access in terms of scheduling, so that when our employees or family members call to schedule an appointment, we're at the top of the list and able to get in to access that care before the general public. And so that's another example of where we know that there is a strain in terms of available mental health resources here in our community. And so because they've agreed to give us that preferential access, if you're on the standard or choice PPO plans, it's a $0 cost share for you to access their services. And another area that we spend a lot of time on as the employer is having discussions with the local healthcare systems and their leadership on the impact of cost and how that impacts our employees, how that impacts us as an employer, and how that impacts the community as a whole. And so we, I think, do a great job having those discussions with leadership at UC Health, with leadership at Banner, and other independent providers here in our community, because we ultimately all have to work together. It's an ecosystem. And so we want to be an advocate and a voice to represent you out in the healthcare community. Now, from an employee perspective, I always like to bring it back to the fact that we're a self-funded health plan, and where you go for your care matters. I hope I've made that point very clear, because depending on where you go, our plan could pay, in that knee example, $100,000 for that surgery, or we could pay $45,000 for that surgery. And because we fund our own claims, whatever millions of dollars we need to fund our health plan for a given year is what we use to determine what our premiums are going to be. So if we are wiser consumers of healthcare and try not to use as expensive providers, that can ultimately have an impact in terms of our premium rates and the ability to keep them the same. We've done premium holidays in the past where we actually didn't charge premiums because we were saving and having a good year in terms of utilization and how people were accessing care. And so it matters. At the end of the day, it really does matter. So we try to provide as many resources as we can to help empower our employees when they need to use the healthcare system. So just a reminder of a few resources that we have. One is getting a second medical opinion. So if your provider is recommending a course of surgery, for example, we partner with a vendor called Second MD. That's free for anyone on the medical plan to use. And you earn a $100 reward for completing that second medical opinion with them. So it's a very simple process where you fill out an intake form online and basically explain your situation and what's going on. You have a call with a nurse who then will refer you to a physician who's an expert in whatever field it might be that you're needing care in. They will seek medical records from your provider to refer to if needed, and then meet with you to have a comprehensive discussion in terms of your recommended course of treatment and what their observations are. So that's one resource that I like to make sure folks are aware of. Healthcare Blue Book, we've talked about quite a bit, so I won't belabor on that point, but I will just say it's a great tool, and we highly recommend you checking it out if you haven't already. I also mentioned our providers at the Wellness Clinic. Our Wellness Clinic is such a great resource, and the staff there care so much about helping our employees and their families. And so they can be an advocate and a navigator for you wherever you are in your healthcare journey. And if you're not sure where to start, you can always contact the benefits team. That's one thing that I just really love to promote and make sure people are aware of is that we have, a 5-person team, and all we do is manage these benefits for our staff. And part of the service we provide is that if you're having an issue with a bill or a claim doesn't seem right, or if you need a prior authorization done and something's just getting stuck somewhere and you need help, call us, email us. Part of our job is to take those issues and get them resolved quickly. And usually we can get them resolved within 24 to 48 hours. Don't waste time and hours of your precious day being on hold with customer service or calling different people back and forth when you can reach out to us and say, hey, Jennifer, I got this bill and I really don't understand it, or it doesn't seem right. Can you look at this for me? And the answer 100% of the time will be yes, absolutely. Let us help you. So I just like to make sure that you're aware that we are here and we are eager to help. So with that, I'm going to start to dig into the questions that we had in our chat. And feel free to continue to type in questions into the chat as we go along here. So it looks like Rachel might have been in there already answering some of our questions. So that's great. So I'm going to scroll down. So yes, this webinar has been recorded. My apologies if I didn't mention that up front. Danny, it looks like Rachel sent you the information on Healthcare Blue Book, so that's fantastic. Thank you, Rachel. But I'll pause and just give folks another few minutes here to type any other questions they might have in the chat. All right, well, I'm not seeing any other questions coming through in the chat, which is totally fine. Caitlin, thanks for your question. You caught me. So the question is, can you help with getting a prescription covered by the plan? And so I'm going to stay with Caitlin's question here. So we can definitely help look into that. We can't guarantee that we can get a prescription covered, but I would say at least come and start with us and let's have a conversation about what's being denied and let's look into why it's being denied. And then we can look into it further from there. Sometimes certain prescriptions aren't covered by a medical plan for various reasons. It might be considered, maybe it's too new to the market. It's still considered experimental or investigational. But I would say, without providing detail here, because we don't want to get into detail, reach out to me afterwards and we can talk about looking into that further for you. But yeah, that's a great example. Like anything, like that, just come and ask. It never hurts to ask. And then Delene, thank you for chiming in. So Northern Colorado seems a little more expensive for procedures. Is there a way to meet with UC Health and MCR to see about negotiating lower costs? So yes, we already do this. So we do meet with their leadership on a regular basis to ask for that. And the response is, has historically been, yes, we can negotiate a discount for you to pay lower costs, but in exchange, they will require steerage from our plan. So that means that they would require us to change, UC Health, would require us to change our health plan so that people pay less to see their providers. And then anyone who's not seeing a UC Health provider would have to pay more money for that service. And from an equity standpoint, that is just not something that we are willing to support. We have had the message that we believe that they should just be charging lower costs for the services they provide because we don't believe they are reasonable and fair. And unfortunately, they have not been willing to provide any sort of concession there in terms of fees and what they're charging, unless we would make that mandatory change to our plan design. So it's very unfortunate that we're at a crossroads in terms of that, but we do continue to ask. It's not like we just asked once and we said, oh, okay, and parted ways. We continue to talk with them. We meet with UC Health representatives every other month to continue to be an advocate and try to hopefully in the future get them to negotiate those lower costs. And then Nicole had a question. So once you search Healthcare Blue Book and schedule with a green provider for your procedure, what else do you have to do to get the award? Really, that's it, Nicole. So how that process works is that once you know you're going to have your procedure done, you need to go into the tool and look it up within 90 days from when your procedure is scheduled. And then Healthcare Blue Book sees that on their side. And so their system is programmed to then send a notification to Meritain to say, Nicole looked this procedure up. It means she qualifies for the $0 cost share for that procedure. And then Meritain will process that as a $0 cost share. Now, I will say that there have been examples where Meritain processed the claim incorrectly. And so the employee will come to us and say, hey, I thought this was supposed to be $0. And the EOB is saying that I owe for this. And that's a perfect example where you just need to reach out to us and let us know, and then we can get that fixed very quickly. But really, once you do your work on the Healthcare Blue Book side, that's all you need to do. And you're welcome, Dylan. It's a laborious process, but we're passionate about it and we're never going to give up. And we'll continue to be an advocate with our local healthcare leadership to continue to plead our case as to why we think we shouldn't be charged as much as we are for healthcare services in Northern Colorado. But really appreciate you listening today. Share this information with your coworkers, share it with your friends and family, because we want people to talk about this. And we hope that if we can continue to create more awareness, that will just help everyone. So Thank you for all the thank yous, you guys. We really appreciate it. Again, it's a 5-person team, and also thanks to Bridget Paris, who's our director of HR, for being supportive for what we try to do as well. So um, with that, we'll go ahead and close out today's webinar. Follow up with me directly if you have other questions you think of, or if a coworker does, please send them our way. And we hope you all have a lovely long Labor Day weekend. So thanks again, everyone. Bye-bye.